student, this is Shumona from Simmi Foundation. Today we are all gathered here to learn about an interesting topic named thyroid hormones and their functions. So let's get started. Thyroid hormone secreted by the thyroid gland. Glands secrete major hormone which is thyroxine and triiodothyronine. Thyroid hormone controlled by the primarily TSH, which is thyroid stimulating hormone secreted by the and pituitary gland. Gland also secrete calcitonin, which is play an important role in calcium metabolism. In this slide, we have to know about the transport of thyroid hormone. Both T3 and T4, which is known as thyroxine, T4 and triiodothyronine, which is T3, are bound to plasma proteins. Thyroxine, which is binding with globin and form TBG, and thyroxine binding prealbumin, which is shortly known as TBPA. Thyroid also bound with albumin. T4 is secreted 20-fold excess over T3. TBG, which is thyroxine binding globin, carry 80% of bound hormone and 10% by albumin and 10% by TTR. So approximately binding with plasma proteins, they are 99.98% T4 bound and 99.7% T3 bound. Unbound hormone is available for the biologically action activity. These terms are slightly different for you, but if you have twice or thrice, you can easily understand the topic. Now we have to know about the synthesis of thyroid hormone. About 93% is secreted as thyroxine and 7% as T3. However, eventually converted to T3 in tissue. T3 is 4 times potent than T4. Here is an important thing which is known as iodine metabolism. Iodine is required for the formation of thyroid. About 80% is shorted in thyroid gland. Ingredients which prevent the utilization of iodine are called goitrogens. So here in this chart, we can know about the synthesis and secretion of thyroxine. What happened in there? First of all, uptake of iodine, then oxidation of iodine, then iodination, then coupling, then storage, utilization, hydrolysis, release, scavenging of iodine, transport of thyroid hormones, and catabolisms of thyroid hormones. You guys have to carefully see these slides step by step and have to memorize them in correct order. Now we have to know the effect of thyroid hormones. Here are 5 different types of function are titled for understand. So first of all, we have to know about the lipid metabolism. How thyroid help in lipid metabolism? Thyroid involves in fat mobilization, oxidation of Fa, which is fatty acid, inversely related to hormone levels. And then we have to know about the how thyroid hormone help in carbohydrate metabolism, enhance insulin dependent glucose entry, increased glucogenesis and glycogenolysis, and then growth. For normal growth, thyroid is a function for growth and development in human beings. And then development, physical and mental development in fetal, neonatal, young and adult. And then we have to know about the other effect of thyroid hormone: cardiovascular, central nervous system, reproductive system, hemopoiesis, skeleton, GIT and kidney. And the other functions of thyroid hormones are: it controls heart rate, hypertrophy, TSH production, growth hormone production, protein catabolism, glucose utilization, fat oxidation, growth and maturation, and reabsorption. And now we have to know about the thyroid disorder. If thyroid is present in our body from the normal range, then what kind of disorder we may face? Here are four types of disorder in there: cretinism, hyperthyroidism, hypothyroidism, and euthyroid goitre. So here hyperthyroidism is intolerance of heat and hypothyroidism is intolerance to cold. These two are different. And in this slide we'll know about the drugs for thyroid dysfunction. Thyroid supplement by thyroxine and thyroid inhibitors are antithyroid drugs. Ionic inhibitors inhibit hormone release, destroy thyroid tissue. So student, in this video we can know about what is thyroid hormone, what is the function of thyroid hormone effect, and what is the disorder of thyroid hormone. This slide is slightly difficult, but if you carefully watch the video, I think you can understand. So student, for today that's all. Thank you and keep learning.